Friday one was a clinical science meeting. The Saturday and Sunday one was actually a basic science conference. So, and it's very important, like the Szeged team, one of our biggest advantages is to think translational manner. So we ask the questions in a clinical at the bedside, we go to the laboratory at the bedside and try to find solution and we bring it back to the clinic. So actually we would like to show the power of translational medicine. So on Friday actually we discuss clinical questions, clinical possibilities, controlled randomized trials, what we could perform, and actually we established the East and Central European Study Group, which contain about in a population of 150 million people in this region. So first we asked the questions, and Saturday, Sunday we could get some answers in a basic science. So I think organizing meetings in which both basic and clinical sciences are included, I think this is the way of the modern science.
Berlin-Chemie has a number of medicines for different therapeutic areas, and one of these therapeutic areas is gastroenterology with a focus on pancreas insufficiency. This is the reason why we were very happy when Professor Hegyi invited us to be the sponsors of the Hungarian Pancreatic Study Group, and we are happy to sponsor all the conferences and the related studies of the group as well.
We have now been working with this group since its start, so its infancy, so it's very early days. Gastroenterology is important for us. We saw a very clear project with Peter. He had very clear objectives and there were very clear milestones. And we honestly felt there was a very big need for the patients in this, pancreatic patients in this registry. So those were the main drivers for us to get involved.
Today I'll try to give you a spiel of what we are doing in the management of acute pancreatitis with very mini review on what are the most updates in the field. And the updates would probably mostly pertain to adult studies and how we took that and translated it into the care of pediatric patients and hoping to get from there to what the future should look like for acute pancreatitis management. I would like to say that acute pancreatitis is common in pediatrics. It is a problem that we thought in the past is not common, but we know now that it's increasing in incidence, and maybe that's mainly because we are aware of the problem, so we're checking for it more. And it does also have major implications on the kids' health and the family dynamic, because once a kid has one attack, there is a risk, almost a 15% chance that they will have more attacks in the future.
This is my first time in Hungary, in Szeged. It's beautiful, and the hospitality so far, and Andrea took us to parts of Budapest yesterday, and I saw that the Danube is really blue, and I always heard about blue Danube, but it's really blue. It's not green like the rivers in the US. And Peter said that I think Iowa City and Szeged is similar, and I just have a slide about this. So I'm from the central United States, so Midwest, and I think there are a lot of similarities.
I just talked about how we build INSPIRE, a multi-center study to study pediatric acute recurrent and chronic pancreatitis. And I gave some background about these diseases in children and how INSPIRE was built. And I also gave an overview of our findings. So what we're finding is that the genetic risk factors and obstructive risk factors are most common in pediatrics, which is different than what is found in adults, where alcohol and smoking are more commonly associated.
So my task is to talk a little bit about what we do know about the treatment of recurrent pancreatitis and chronic pancreatitis. And I was given the mandate of focusing on total pancreatectomy and autoislet cell transplant in children.
I think this was an exciting opportunity to meet additional people interested in the pancreas and to have further discussions about potential collaborations. and working together to solve to develop new therapies for this devastating illness.
Thank you very much for this nice talk. I mean, this operation is quite a life-changing event for all these patients, and I just wanted to ask you how long, in average, the consideration to proceed to this operation takes you with the children.
Well, a lot of the patients that we've done have come from other areas.
I think the discussion was very appropriate. A lot of it centered on whether or not the operation, the total pancreatectomy, should be done in children, and I think that's a very important discussion because it's an operation that you can't reverse. Once it's done, and it's a major step for children who hopefully have a full life ahead of them.
So in conclusion, chronic pancreatitis is the end of a sequence of events that leads to irreversible organ damage. The irreversible organ damage is not the diagnosis, that's the bad outcome. The diagnosis is a dysfunction in one of the molecules that has a genetic cause. So this is my second trip to Szeged, and I looked forward to returning. I think the number of outstanding international scientists that have come make it a very important and dynamic meeting. The lectures are interesting, but the chance to sit down together with physicians and scientists from Hungary and other countries and discuss the new ideas and approaches and successes encourages everyone and helps push the field forward. So that's really the highlight. It's the colleagues that I work with, and then we try to teach the trainees and students and others some of the things that we have already completed.
I will focus on trypsin, as Dave already covered, the ductal risk factors. Both on Friday and Sunday, I talked about genetic risk factors in chronic pancreatitis. And on Friday, we focused on pediatric cases mostly, and then later on, we went on to alcoholic chronic pancreatitis. Hungary traditionally been very strong in pancreatic research. The Hungarian study group was founded 3 years ago, so they made tremendous progress since then. So I think within a few years, if they keep up this progress, they will be one of the strongest in Europe.
I would like to give a little overview what we have done in the last couple of years and how our relationship came to science and was basic to clinical science in the last decades. We also started organizing clinical trials. You will hear in the afternoon. István Ritz will speak about the EASY, an early achievable severity index in pancreatitis, which were actually discussed also in the APA meeting, that we need really a good system at admission to get it. Joe Dubravchik will speak about preventive pancreatic stent, how to use it in biliary pancreatitis. This will be a randomized control trial, an RCT, and also we started working in pediatric pancreatitis. Andrea Parnitsky will speak about the analysis of pediatric pancreatitis, and also Fanny Zsoldos will speak about the pain actually in the early phase of acute pancreatitis, how we can actually recognize it. So we immediately started 4 clinical trials.
I'm very excited to be here. It's my first time in Hungary, and I know Peter and the organizers from my work when I was in Iowa, and I worked on cystic fibrosis pigs at that time, and we collaborated, but also from yearly meetings with the pancreas meetings, I got to know the very dynamic group here, very smart people dedicated for the disease, really. So I was thrilled that he invited me in July to come, and I said I would be more than happy to tell you about my research in pediatric pancreatitis.
I think it is very important for people working in the same field to meet and discuss and exchange ideas. And also I think just meet with new people, meet with junior people who are interested in this research.
I'm always impressed how the chairman, Peter Hegyi, is able to bring international speakers to Szeged, and the quality of the talks, the quality of the presentation, the quality of the discussions, it's very impressive.
What we always try to make every details very carefully to them, just to enjoy the meeting. So we're not only just inviting people and something will happen here because they are good speakers, they can give good presentation, but we try to show you some Hungarian gastronomic culture, some folk culture, so a couple of things which is related indeed to Hungary, and they can't see anywhere in the world.
So this is the rosé? Yeah.
I mostly organize with Miklós and István the clinical part. I think we had today a fantastic clinical meeting with plenty of really brainstorming, and we just established the Central and Eastern European study group with more than 10 countries with 30 centers. We already have more than 1,200 patients in the database, and luckily we will be able to start 4 prospective studies. One of them is a randomized clinical trial, and the other, so we are, I think, really on the good track. But so we can be proud in the last couple of years, but I am most proud not because of the clinical meeting, but because of the basic science meeting, especially Victoria and Joseph, because Victoria was my first PhD student 10 years ago when we started building up the laboratory, and after Joseph came, so now, as I said, officially I retired now as an organizer, so I would like to close the Hungarian Pancreatic Study Group meeting, and I am more than happy to deliver the official duties to Victoria and Joseph. So thank you for the Hungarian Pancreatic Study Group, the international and Hungarian guest. I also welcome the others, and now I sit down and will enjoy for the first time many years, to have a rest, and please, Victoria and Joseph, welcome.